Hi, I'm Dr. Tiana Seetzy at RejuvenationMD in Burlington and Bellingham, Washington, and today we are doing an InstaLift procedure, which is a great treatment to help just reposition your skin. People typically use it in the face, you can also use it in the neck, and we're also doing it in some other areas where people just want a little bit more lifting, such as knees, elbows, etc. So now I'm going to inject some lidocaine with a very tiny needle into the areas where we'll be putting the InstaLift threads. So I've drawn on her now, and I'm going to go exactly where we're going to be. I'm going to inject exactly where we're going to be entering and where we're going to be exiting. You okay? Mm-hmm. So now I'm going to make a little pilot hole or channel into our patient's cheek for our first thread. So I have numbed her already. You okay? Mm-hmm. Okay, great. Make sure this is our thread that we're going to be inserting. She is also at this point inhaling some Pro-Nox, which is making it an even more pleasurable experience for her. Even more. Okay. There is a channel right under the skin where is the right depth. And you should not feel that, okay? It'll feel like a pressure, but it shouldn't hurt. Yeah, that's a great depth. You okay? Mm-hmm. Everything's okay on Pro-Nox, actually. Mm-hmm. All right. Here we go. And pull it through. You okay still?
Yep.
All right. I'm going to ask you that 1,000 times. Now we're going to go back into the same spot, and now we're going to go down. Perfect. Come out right here. Doop. There we go. Now she has her first thread in, and here it is. So now we've already finished her first side, her left side, and we're moving right along to her right side. How are you doing? Good, good, okay. Now that Pro-Nox really helps too, but our patient's had no pain. She's such a trooper, and we're gonna go ahead and start doing the pilot channel for her right side now. Here we go. Really, the number of threads that you need per side depend on the size of your face and what you're really looking to accomplish. So today we're doing 4 threads per side. Sometimes, a lot of times we'll put a couple in the neck too to pull the neck back. And again, if she had a bigger face, she might need 5 or 6 threads per side. But she's a trooper, she's doing great, and we're just gonna continue on here. So now we're going to fasten the cones and the knots on this side into her skin. And she's going to notice immediately that she has got a lift, but the most lift is actually the best results are going to be in about 5 to 6 weeks and even up to 3 months, where her skin is going to be glowy and repositioned, upright. It looks beautiful. People lots of times will tell me, oh, I looked at myself in the mirror yesterday and now today I look better. And then they say, oh, and then the following week I looked even better. Isn't that weird? It's not weird. It's because you're making collagen. So it's a neat process to see how people's skin develops over time in response to the InstaLift. You got the instant repositioning, then you got the encapsulation, and then you have the collagen formation in that upright position. So that's why it's called InstaLift, and that's one of the many reasons why we love it. So now all of our threads are in. I still have the needles attached, but what I'm going to do is I'm going to fasten them so they sit well in her skin. So we're just going to put a little arnica gel on her, and I'm going to pull a little bit and just make sure that it fastens into her skin. There's little cones and knots on each of the threads, so to prevent the threads from moving down. And that's how they stay in place. But we do have to essentially like deploy them so they stick down in there real good. And then I'm going to pull all these ones at the top, make sure that the top part of the cones are fastened in as well. Sorry, you don't mean to be smacking you with this. So it's going to push down. And then again, over the next couple weeks, these are going to be encapsulated by her skin, so she's not going to feel the thread. And then her body will start to make collagen in response to the poly-l-lactic acid that these are made out of. So sometimes people can bruise, sometimes you can get a little dimple or two that will all go away. That'll look great. You okay? Okay, awesome. So we'll go to the other side and we'll do it over there. Okay, so now we are just about done. These are all the needles that we used to insert the InstaLift, and now we're going to get rid of them because we don't want her going around with those for the rest of her life. So let's cut them off. And it's super simple. See, that's it. We're just going to do that for each of them. And then she'll be able to walk out of here and just look normal. Some of the lidocaine that I used to help make her numb over here has left a little white area because of epinephrine that's in the lidocaine to help decrease the risk of bruising. That discoloration is going to go away within the hour. She has a couple little tiny little dimples that happens often with the insertion spot for the InstaLift threads, but those will all resolve in the next week or so. So that'll look nice and smooth. But she'll be super happy, and then again, every time she looks in the mirror, she'll see how much better she looks. I mean, she started very pretty to begin with, but now she'll have that extra lift and repositioning and new collagen. So if you decide you want to do InstaLift, come and see us. Super easy, and RejuvenationMD, that's where we are.